HMPV is an acute respiratory tract infection which can affect people of all ages, but it is particularly common in children. And while RSV is the viral respiratory disease which affects those under 2, HMPV is most commonly found in older children, and indeed China's Disease Control Center is saying that the northern regions of the country have particularly high case numbers and particularly high spread at the moment of HMPV amongst those 14 and younger, and with it are coming symptoms such as a cough, shortness of breath, congestion and fever, very similar to the flu and COVID-19. The disease has been around since about 2001 when it was first discovered, but there is still no vaccine for it, and so experts are warning people to take precautions, to not necessarily go out and ask for prescriptions of antivirals indiscriminately, but to stop the spread of the disease using the precautions that they're familiar with, such as washing their hands frequently, trying to contain the spread, and wearing a mask. And the regions around China are being vigilant as well. Hong Kong is monitoring its cases and has found there's very little spread at the moment, although there are concerns about cold and flu season going into mid-January, particularly in Hong Kong, looking at countries like Japan, where influenza A has been spiking in terms of case numbers here. The cases of influenza doubled in the week leading up to December 22 to reach about 211,000 in Japan. And so authorities all across Asia are watching the flu outbreak, are watching the respiratory virus outbreak in China, and urging everyone to control the spread of these diseases by washing their hands and wearing their masks.